Total knee replacements are one of the most common orthopedic procedures and provide pain relief, restoration of function, and mobility to a number of patients with a variety of pathological conditions affecting the knee. It is a major procedure, but with effective post-operative management, patients can be out of hospital and mobilizing effectively within a few days. This requires the use of allied healthcare professionals, namely physiotherapists, effective pain management, prophylaxis against thromboembolus formation, and wound care to prevent infections. So the goal for pain management after a total knee replacement is to provide effective analgesia that allows immediate rehabilitation and early mobilization. The preferred method of management is NSAIDs combined with an anti-inflammatory. Other methods that can be used include the use of peri-articular local anesthetic or regional anesthetic techniques. Opioids can be used but are generally not the primary choice for management. Early mobilization is encouraged to prevent thromboembolus formation. Added prophylaxis in the form of low molecular weight heparin has shown a 70 to 80% decrease in thrombosis postoperatively when compared to cases where no chemical prophylaxis was provided. Low molecular weight heparin has also been shown to have a low risk of serious postoperative bleeding. Low molecular weight heparin can be commenced between 2 hours preoperatively and 6 to 8 hours postoperatively. Postoperative initiation is associated with a lower risk of major bleeding. Low molecular weight heparin should be given twice daily and discontinued on discharge. Meticulous wound care is needed to prevent complications due to infection. Patients should be advised to monitor for signs of infection, such as redness, warmth, foul smells coming from the wound, or oozing through the dressings. Patients should avoid showering for 3 to 4 days after surgery. They should avoid soaking the wound in water or letting water beat down on the wound if showering. Patients should keep the surgical wound dry and clean and bandage the knee to avoid irritation with clothing. Staples will be removed 10 to 14 days after surgery if the wound is healing well. Cooperation by the patient in a post-operative rehabilitation program is required for a successful outcome following total knee arthroplasty. Interventions that attempt to preserve knee motion include the use of a knee immobilizer and pillow under the operative foot while in bed to maintain extension and to avoid flexion contracture. Range of motion exercises supervised by a physical therapist should be started as soon as possible. Rehabilitation goals should be realistic. Although the flexion deformities may be partially or completely corrected by total knee arthroplasty, the maximal knee range of motion may not be much improved, and the post-operative motion is determined largely by the pre-operative arc. A well-structured physical therapy program, including range of motion, gait training, quadriceps strengthening, and training in activities of daily living, is an important component of the rehabilitation process. Inpatient rehabilitation has not been shown to result in improved mobility compared with home-based physical therapy in patients who have undergone an uncomplicated knee arthroplasty. For this exercise, you're going to pick up your toes as far as you can comfortably and then point them down as far as you can comfortably, repeating 10 to 20 times and working your way up to 2 to 3 sets per day. For this exercise, place a rolled towel under the post-operative knee. Push your knee down straight, hold for 5 seconds and then release. Perform 10 to 20 reps and work your way to 2 to 3 reps per day. For this exercise, bend the operated leg up and down in a nice, comfortable range of motion, holding at the top for 2 to 3 seconds. Make sure your heel maintains contact with the bed surface. Work on 10 to 20 reps 2 to 3 times per day. Place a rolled towel under your knee and lift your heel up off the bed to straighten your leg. Hold for 3 to 5 seconds and lower. Make sure your knee stays in contact with the towel at all times. Repeat for 10 to 20 reps, 2 to 3 times per day. Bend your non-operative leg on the bed and raise your operative leg straight up off the bed, trying to keep the knee as straight as possible. Do not lift the knee higher than the height of your bent knee. Repeat 10 to 20 times, 2 to 3 times per day. Sit upright in a chair with your operative foot on a towel. Make sure you're on a non-carpeted surface and that you shift your weight onto the leg that you are exercising. Pull your foot back, bending your knee as far as you can comfortably. Hold for 3 to 5 seconds and then push your foot back forward. Repeat 10 to 20 reps, 2 to 3 times per day. Again, while seated in your chair with both feet firmly planted on the ground, lift your operative leg and extend your knee. Hold for a count of 3 and return it to the floor. Repeat 10 to 20 times, 2 to 3 times per day.